Good morning, everyone, and I'm delighted to be here this morning and to welcome you all to Croke Park to officially open the National Drug Forum 2023, the fifth one. I particularly want to welcome all the speakers who have given up of your time and travelled to be here this morning and to share your research and your expertise. And I really want to sincerely thank you for that, and it is greatly appreciated. I also want to welcome those of you working in drug prevention, treatment, harm reduction, and advocacy, because your voices are also incredibly important and valuable as part of this process. The National Drugs Forum, it's an eagerly anticipated event each year for everyone who works in areas related to drug policy. So this annual gathering provides an opportunity for all stakeholders and interested parties to learn about and to discuss new developments and thinking in drug and alcohol research and related policy areas. And it also gives us an opportunity to meet in person and to strengthen both our professional and personal relationships. Every year, there's a different theme that is relevant and topical to all of our work in this area, and it keeps us informed and provides a much-needed forum for debate and discussion. And I'd like to thank the Health Research Board for organising the forum and inviting such an interesting panel of speakers who I hope will inspire you and get you all thinking and discussing and sharing your thoughts about what you hear here today. The focus this year is on aligning research planning with policy priorities, which is very timely. We all recognise the importance of good quality, up-to-date research and how it can inform our thinking and our practice. And in a fast-changing and evolving environment, research helps us to respond quickly and appropriately. This is a very opportune moment to discuss alignment between research and policy, particularly because both the Irish and EU drug strategies will come to an end in 2025. And the process of considering and developing a new strategy is therefore on the horizon, which makes this event really important. As you'll know, following the midterm review of the National Drugs Strategy, 6 strategic implementation groups were established to drive key areas for the remainder of this strategy. The importance of research and evidence-based decision-making to this process was recognised by the establishment of Strategic Implementation Group 6, which was set up specifically to strengthen evidence-informed and outcomes-focused practice, services, policies, and strategy implementation. A research subcommittee was also set up to support the work of the National Oversight Committee to ensure the research and monitoring actions of the strategy are carried out efficiently so that drugs policy can be informed by data and evidence. I fully expect that the development of the next drug strategy will be informed by the wealth of great research and expertise that we have available to us here in Ireland. Good quality data coupled with vigorous analysis are vital tools to policy makers to ensure that the policies they develop are fit for purpose. As we all know, research helps to provide an informed picture about these issues as they change and evolve, and it allows us to anticipate and to react to current and forecasted trends. Since my appointment to the Department of Health just 11 months ago, I have met with people who use drugs, some of whom are living with addiction, medical experts, and people delivering addiction services on the ground. And one key message that I've received has been that we need to change how we think about and tackle drug misuse and addiction. And your deliberations will play a really key part in helping us achieve just that. You'll hear from several people with a wealth of expertise who are key players in influencing policy from a research and evidence base. You'll hear from Dr. Nada Milosakovic from the Migration and Home Affairs Directorate General in the European Commission, who has a particular interest in bridging the gap between research and policy. There will be a presentation from Professor Kirsten May, an international expert on drugs policy with many years' experience observing the link between evidence and policy. Other experts in the field include Sarah Morton, an academic specialising in health services, Susie Lyons from the HRB, Sarah Trevelyan on the impact of the Sláinte Care reforms. Also here today we have Mr. Paul Reid, who is chair of the recent Citizens' Assembly, who will share his own reflections on the Assembly process and the implications for policy. I want to take this opportunity to sincerely thank the Citizens' Assembly members, Paul Reid and the Secretariat, for their hard work and all of their interest and dedication and their commitment over the last 7 months to discuss the many aspects of drug use in Irish society, and who went on to agree those 36 recommendations. Those recommendations set out an ambitious, comprehensive and a health-led approach to reducing the harmful impact of drug use in Ireland. And I look forward to receiving the report of the Citizens' Assembly and to giving it detailed consideration in conjunction with the Oireachtas and my government colleagues. So I want to thank you all again for being here today to share your knowledge and your expertise. Your contributions are really important to ensure that the evidence and the understanding we have on drugs policy, on changing, that we can adapt and be flexible to the emerging trends so that we can collectively meet the challenges that lie ahead in the future. So I hope you have a very constructive and enjoyable day. So, Thank you.